Medical Center was the first hospital in downtown Houston to care for the hearts of our community. As technology has moved forward, St. Joseph Medical Center hasn't missed a beat in keeping up with heart health. With more on their overall heart program, please welcome interventional cardiologist Dr. Philip Haas and cardiothoracic surgeon Dr. Eyal Porat with St. Joseph Medical Center. Hello there. You know, when it comes to heart health, there's a wide gamut of what we have to focus on. But before we get to that, St. Joseph has such a long, deep history in this community when it comes to overall health care as well as heart.
True. I mean, it was the first hospital in Houston and has a long history of providing cardiovascular care to our community. And we are involved in reinvigorating the cardiovascular program at St. Joseph's, and that's a big part of why we're here today to talk about it.
Yeah, we talk often about what's happening in our society today where heart disease is prevalent. #1 killer around the world of men and women.
Absolutely.
And how much that has to do with our food and things like that. Have we seen that really increase over the years because of our lifestyle?
I believe the lifestyle plays a huge role in the prevalence of heart disease. You're right, it's the #1 killer of all human beings on this planet. And so, you know, genetics is a big role, but lifestyle, diet, exercise or lack thereof, and so forth plays such a huge role.
I keep using the statistics, but I think it's probably the most important thing the CDC has said over the last several years, and that is more people are likely to die from family recipes than from DNA. And you're right, DNA has a part, but I saw a figure, and I don't know how correct this is, but roughly 80% of heart disease is what we do to ourselves.
Absolutely. Again, there is a genetic component, but I think the vast majority is risk factors that we can actually control on our daily life. So diet, physical activity, like Dr. Haas mentioned and you mentioned earlier, there are a lot of risk factors that we can modify, and this is something that we need to take responsibility and make sure that we do whatever we can to minimize those risk factors.
So education obviously is very important, and us owning that education, doing something about it. But when that fails, and it does often, we know that there are services, new services, just like I mentioned that technology has changed over the years since St. Joseph first became a hospital here in Houston. You have some new services, and you've expanded some things to kind of reach out into the community. Let's talk about some of those.
From a cardiology standpoint, I'm the interventional cardiologist, Dr. Pross, the cardiovascular surgeon, so I'll speak about what we offer from a interventional cardiology standpoint. When it gets to the point that diet, exercise, lifestyle have failed, and you actually do present with heart disease, we have a wide gamut of treatment options that we have available in our cardiovascular program. Everything from diagnostic studies such as stress testing, echocardiography, and so forth, to interventional cardiology services, coronary stents. And
we're taking a look at your new unit right here. I might want to check in here and not leave for a little while, just to decrease the stress on myself, right?
This is something we take a lot of pride at St. Joseph Medical Center. Just recently, they renovated a whole floor specifically for cardiovascular patients, so that the level of care that the patients get, not only that the medical care as far as the physicians, the nursing staff that is second to none, you get the best facility and the best housing in the region. And for the rooms that you've just seen in other hospitals, you need to pay extra. This is the standard of care at St. Joseph Medical Center.
Wow.
Those type of rooms are the standard of care for all the cardiovascular patients. And like Dr. Haas said, the hospital took a turn and put cardiovascular medicine in the heart of the hospital. And they're investing a lot into it.
Well, there's a lot to be said for your surroundings. And, you know, when you feel like you can feel comfortable, it can decrease the stress the whole bit. Both hospitals also have specialized in chest pain protocols. Obviously, we know that time is of essence when somebody has had a heart attack.
Absolutely. The standard of care if someone's actually having a true heart attack is to get them from the emergency room front door to the cath lab and have a stent or an angioplasty within 90 minutes. And we achieve that, or have a history in the last year or so of achieving that 100% of the time. So we offer not only wonderful surroundings to recover, but our outcomes are second to none.
Yeah, let's talk about the symptoms that you might be having a heart attack. And we know that not everybody presents the same. Oftentimes women present differently from men, but just in general, the thing that should send you to the hospital, don't put it off, don't lay down, take an aspirin, go to the hospital.
Well, For the most part, it's chest pain. And anytime someone has chest pain, I tell patients to take that seriously. Don't ever blow that off. Women, oftentimes more than men, but any patient can sometimes have other symptoms such as breathlessness or breaking out into a cold sweat or just tiredness or pain in the shoulders or the arms or so forth. But primarily chest pain is what we look for as the #1 presenting symptom of heart disease.
Another service, it sounds technical to us, but you can break it down for us, the bilateral internal mammary artery approach.
Well, yes, this is something we take a lot of pride.
I feel like I just went to medical school. I'm sorry.
We take a lot of pride of that. You know, coronary bypass surgery is a procedure that is being done for over 30 years now. We use different conduits to do the bypass surgery. We can use arteries from the inner part of the chest wall, which last much longer, and we can use veins from the legs. We take pride that at St. Joseph Medical Center, what we do is we use both arteries from the inner part of the chest wall in over 85% of our patients. The national statistics is 4%. Now, why is that good? Because the longevity of those bypass grafts, the long-term survival of the patients, is significantly higher if we use both arteries. And we're talking about 15-year survival of over 70% if we use both arteries, comparing to about 35, 36% if you use only one artery. So definitely the way to go is by using both arteries. The problem is that in Houston and nationwide, we're talking about only 4% utilization of both arteries. At St. Joseph, it's 20 times higher.
Wow.
We're talking about 85% and above. So if you want your bypass graft to last longer, that's the way to do it. Use both arteries.
So oftentimes people show up to you guys when they're in crisis, but it's a comprehensive program because it can start out with something as simple as the checkup, because you got to at least know where you stand. And then if you're in trouble, you all are able to handle that. So thank you very much for letting us know about the services. For more on St. Joseph Medical Center or to get a physician referral, you can call 713-757-7575, 713-757-7575, or log on to sjmctx.com. Well, out with the old, in with the new. See how old technology can put new cash in your pocket. We'll show you how in Tech Corner next.